Kenya from safe travels to stop travel. With 2 safe travel certifications backing the nation, Kenya is now forced to put new immediate restrictions in place. This third wave of COVID-19 has the number of cases per day and the PCR positivity rate already exceeding the high peaks of previous waves. Public and private hospitals in Nairobi report COVID-19 bed space is filling up and life-saving oxygen may be difficult to secure. When the COVID-19 coronavirus took hold around the World Travel and Tourism Council (WTTC) came out with their Safe Travel Stamp. This stamp of approval by the organization was created for travelers to recognize destinations and businesses around the world which have adopted the Safe Travels Health and Hygiene Global Standardized Protocols. Today, Kenya travel is also standing out as an example that this virus has not yet been defeated, even if it sometimes looks like it at first glance. With not just 1 but 2 safe travel certifications backing the nation, the country is now forced to put the following restrictions in place, pulling on the emergency brake just like many other countries, including Germany. According to the U.S. Embassy in Kenya website, due to rapidly increasing rates of COVID-19, new restrictions are in place effective immediately. In this third wave of COVID-19, the number of cases per day and the PCR positivity rate already exceed the high peaks of previous waves. The Centers for Disease Control and Prevention (CDC) has issued a Level 4 travel notice for Kenya. Community transmission of the coronavirus in Kenya is widespread and accelerating rapidly. Public and private hospitals in Nairobi report that their COVID-19 bed space is filling up. Life-saving oxygen may be difficult to secure. On March 26, President Kenyatta announced further restrictions in response to the worsening of the COVID-19 pandemic. Restrictions are focused on 5 counties declared disease-infected areas, specifically Nairobi, Kajiado, Machakos, Kiambu, and Nakuru counties. The 5 counties. Cuthbert Nube, chairman of the African Tourism Board, is currently on assignment on the Ivory Coast and has voiced his concern about the situation in Kenya. He cautioned that countries should not reopen tourism too fast and instead currently concentrate on regional or domestic travel. Jürgen Steinmetz, chairman of the World Tourism Network, said, "Kenya is not alone. A third wave is attacking most of Europe, Brazil, and parts of the United States as well. The Honorable Najib Balala has earned our hero status and is known to put safety over economic interests. This virus is simply unpredictable, and Kenya is doing the right thing for its people at this time. With this type of precaution in place, Kenya will emerge larger and stronger in the global tourism field." The new restrictions issued by the U.S. Embassy in Kenya include the following. Movement by road, air, and rail into and out of the 5 counties is suspended effective midnight, March 26, 2021. Cessation of movement is in and out of the 5 counties Nairobi, Nakuru, Kiambu, Machakos, and Kajiado, as one zoned area. You can therefore move freely within the 5 counties. You will not, however, be able to leave and enter the one zoned area. Public gatherings and in-person meetings in the 5 counties are suspended until further notice. International travel continues under existing guidelines. The curfew in the 5 counties is extended from 8 p.m. to 4 a.m., starting at midnight on March 26, 2021. Other counties will maintain the existing curfew of 10 p.m. to 4 a.m. Curfew exemption passes are to be reviewed, and until then all existing passes are revoked. All physical and worship gatherings are suspended until further notice in the 5 counties. In other counties, the existing rule that places of worship may only use 1/3 of their capacity remains in effect. In-person learning at all education institutions through the entire country are suspended, except for those sitting for examinations. In-person meetings within government are restricted. Sporting and recreational activities are suspended. Bars are closed in the 5 counties. Hospitals must restrict visitors to 2 individuals per patient. All funerals must be held within 72 hours after the confirmation of death, and no more than 50 people may attend a funeral. Weddings may have no more than 30 people attending. Restaurants are closed for dining and may provide only takeaway meals in the 5 counties, and they may not serve alcohol. In other counties, existing restrictions remain in place, with strict enforcement of guidelines. The prohibition on political gatherings has been extended. Nairobi continues to lead the surge in new cases. Other counties with high COVID-19 rates include Machakos, Kiambu, Nakuru, Antarika Niti. The U.S. Embassy is unable to secure a bed or other medical care for U.S. citizens at private or public hospitals, nor can it provide medical care for private citizens. If one must travel to Kenya at this time, he should have travel insurance that includes coverage for an air ambulance evacuation in the event of symptomatic COVID-19. A person cannot travel on a commercial airline out of Kenya if he is acutely ill with COVID-19. For anyone already in Kenya, maintain strict COVID-19 mitigation measures, such as frequent hand washing, social distancing in public, avoiding large crowds of any kind, and mask wearing in public places. #RebuildingTravel